Samina Javaid. I'm your pharmacist today. What I can do for you today?
Doctor, I am looking for some healthy diet.
Okay.
I'm actually suffering from high blood pressure, so I want to control my blood pressure through some good diet. Can you guide me on that?
Yeah, sure, please. If you don't mind, can I ask you some questions first?
Sure.
Okay. Do you take any medication right now for the hypertension?
Not really, not regularly. So I want to control through some diet, good diet.
Okay. Do you have any allergies?
Not as much.
Okay. Okay. Yeah, I'm glad you are here today to discuss managing your hypertension through dietary changes. And also, can you tell me about your current eating habits?
I'm not particular about any diet because I usually take in the breakfast some slices and some butter with some honey, and in the milk sometime I take the tea or sometime I take the coffee. This is my normal in the morning diet, and thereafter I used to take early dinner around 6 7, and in between sometime I take some snacks, which is not very regular. It depends, if I have a time then I take it, or sometime I skip it that.
Okay. Do you check your blood pressure at home?
Yes. Off and on I used to check that.
Okay, what is that? The readings?
Normal, my blood pressure varies between 130 to 140, sometimes 145, and the low level is around 90, sometimes 95.
Okay.
So I'm worried about that.
Yeah, sure. Thank you for sharing that. It's completely understandable. Life can be hectic. Let's talk about the DASH diet,
Okay.
which can greatly affect your blood pressure. Have you ever considered how healthier food choices might improve your overall well-being?
Actually, I know I should eat better, but often find it hard to stick to a healthy diet. I tend to grab fast food or order takeout, and because it is convenient for me to have a takeaway foods.
Okay. That's okay. Change can be challenging. Let me ask you this. What are some specific reasons that may motivate you to improve your diet and manage your hypertension?
Yeah, I have thought about it, and but I haven't committed to it to take a healthy diet.
Okay. Um, okay. Making small gradual changes in your diet can lead to significant improvements in how you feel. For example, following the DASH diet will naturally lower your sodium intake, which can help reduce bloating and fatigue. What one small step you can commit to taking today to get started on this path towards feeling better?
I want to feel better overall and have more energy. Plus, my doctor told me it's essential to get my blood pressure under control, which is normally not done at the moment.
Okay, that's fantastic first step. Cooking at home give you a better control over the ingredients and makes healthier choices. Remember, progress doesn't have to be perfect, but effort and consistency counts. How can I support you towards your better health and more energy?
It would be amazing. I have been missing out on a lot because I'm often tired and not feeling my best. My have a lot of fatigue in my bodies, so I'm not feeling comfortable.
Okay, you mentioned that you take the like fast food
Yeah.
in regularly basis.
Yeah.
Actually, the processed food can often be high in sodium, which can raise your blood pressure. Let's talk about the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It is designed to lower blood pressure and promote heart health. Um, and I can Okay, the DASH diet emphasizes certain food groups and portion control. Okay, like more fruits and vegetables and whole grains, lean protein, dairy, low fat or fat free dairy, and sodium.
Mm-hmm.
What do you think about that?
Oh, I see. But how do I put this into my practice?
Great question. Let's talk about your plate. Imagine divided into sections.
Mm-hmm.
Fill half your plate with vegetables and fruits, a quarter with lean protein, like chicken or maybe the fish, and a quarter with grains. Don't forget to add a serving of dairy too.
So, like for dinner, I could have grilled chicken, broccoli, and brown rice.
Exactly,
What do you
that's a
suggest?
perfect example of the dash friendly meal. Also, try using herbs and spice to flavor your food instead of salt.
What about snacks? I tend to snacks on chips a lot.
Oh, snacking can be healthier too. Choose option like unsalted nuts, yogurt, or cut up veggie with hummus. These are much better for your blood pressure than salty snacks.
Does not sound too hard, but what if I have craving?
Okay, craving as are actually usual. When you crave something sweet, try a piece of fruit and maybe air popped popcorn and maybe whole grain crackers with a small amount of cheese. And remember, it's okay to have occasional treat in moderation.
Thanks for explaining all this, doctor. It makes sense now. I think so.
You're welcome. The DASH diet is a long term approach actually to managing hypertension. It might take some time to adjust, but I'm here to support you along the way. We will schedule regular follow ups to track your progress.
That sounds reassuring. I will give it to my best shot. I will try to adopt this dash dash in my life.
That's a